Hi everyone, it's Alicia Lillington. I'm sharing my Hodgkin lymphoma journey here on YouTube. I'm a 33-year-old mum of a 15-month-old. I was diagnosed with Hodgkin lymphoma in April 2025, March-April 2025, and I'm sharing my journey in the hope that it'll inspire someone, it'll share some insights, who knows, putting it out there into the universe and seeing what happens. So this last couple of weeks was very hard. I feel like now I'm kind of coming out of it, but I had some really low moments. I had some challenging news that I wasn't expecting. I'll just get into it and explain what happened. I'll be sharing some things as well that are a little bit more medical, and trying to explain them in lay person's terms so that it's a little bit more palatable and you might be able to understand. So basically, my Hodgkin lymphoma, I was expecting to do a type of treatment called ABVD. Each of those letters stands for a different drug that gets injected via an IV every 2 weeks. In the hospital, I started my treatment about 9 weeks ago, and I was expected to be about halfway after doing 4 lots of chemo over 8 weeks, and after that you do a PET scan. So you do a PET scan at the start, but like when you first diagnosed with cancer, to see where the Hodgkin lymphoma is. Then you do one halfway to see how your body is going and reacting to the treatment. So the first PET scan showed, like before I started chemo, showed a lot of cancer and lymph activity. The PET scan, basically you get injected with a radioactive dye for an hour, go into the hospital. No one can be in the room with you. And you just sit there. They don't like you to be on your phone. They don't like you to read a book. They just like you to sit there. And you get injected with a radioactive dye. No nurses or anyone can be in the room. So but it's strange because you're getting it as a patient injected into you. And then after that, you go in a big machine. It's like an MRI type machine, except it's on your whole body. And for me, with Hodgkin lymphoma, they're focusing on sort of this area, as that's where the main activity has been for me. So when they first did it, before I started chemo, there were multiple lymph nodes that were enlarged and masses. One of them in particular was 42 millimeters by about 30 by 20. And so then I did chemo for 4 rounds every 2 weeks. And then after that, had another PET scan recently to see where everything was at. I felt and had this intuition that the cancer was completely gone. I can't explain it to you, but I just had this faith and this feeling. I'm like, I mean, different symptoms had gone away. So some of the tumors impacted my voice, and I was diagnosed with vocal cord palsy, as you might know if you've been following my journey. I couldn't breathe because different lymph nodes and pressure points and airways were getting impacted by the tumors. I had a referred pain in my ear. I had all kinds of things, and a lot of these symptoms went away. I was just feeling better within myself. I do feel like I know my body pretty well, and I can just have a general sense, especially after giving birth. I really trust in my body and understand kind of where it's at. So I thought the cancer was gone. I did the PET scan, and then it was a long weekend. Then I went to meet my hematologist at the hospital, who's my cancer doctor, who specializes in blood cancers. And I decided to bring my 15-month-old with me. I brought my sister with me. I brought my husband with me, because I just had this vision that I was going to go to this meeting and they were going to say, you're in remission, the cancer's gone, it's all better. And I just had this idea that that's what was going to happen. When I went there, basically it was a little bit different. They said like a lot of it had gone, but there was still a little bit there. And so basically it was the tumor that was 42 millimeters by 30 by 20. And it was now 6 millimeters, so much smaller, which is good news. And I didn't get to read the report directly at that time of what they'd said, but later on I got the report, and it did say this is an excellent response to treatment. So that's really positive, right? But then the hematologist basically said, and she was excited, she thought we had like a really good result, but when she looked at it a little bit more closely, they look in the PET scan at the level of brightness of the cancer versus other parts. And before I started chemo, the brightness of my cancer and the lymphoma was about 13 point something. It was now on that 6 millimeter one down to 2.9. So I don't even know what these brightness things are, but this is kind of what I understand. I think it's called the SUV. And so that's really good. But they want to compare the brightness of that one against the brightness of your liver. And basically they want your liver to be brighter than the cancer. And if that happens, you get this score, a Deauville score of 1 to 3, which means you're in remission. But if it's 4 to 6, it's a little bit different. So then, 2.9 was the brightness of the piece that was still there, the small piece. But my liver was only 2.6. So then my liver was not brighter than the cancer. And so basically when that happens and you're not in the 1 to 3 Deauville score, the next step is potentially to extend your chemo by 2 months. I had this plan that, all my chemo treatment was going to be over by end of July. I'm definitely a planner, and, I understood there were 8 rounds of chemo over 4 months, with those 28-day cycles with chemo on every day 1 and 15. And I thought I was like halfway. And then to get that news of adding on 2 more cycles, 4 more rounds of treatment, it's just like, then I wouldn't even be halfway, I'd be a third of the way. So that was hard. But the hematologist said it's very close. So she said the next day they would have a meeting with a multidisciplinary team of her peers, and she'd be able to review it at that point. And that day was when I had chemo. I didn't have a very good round 5 of chemo. I had some challenges, and I had this in round 3 as well. Then I had a really good round in round 4. But round 5, I just had people that were not introducing themselves, not wearing name badges, not explaining what they were doing. And I really like to know what's happening when I'm at the hospital and, what drugs are you putting in. And I've had a bit of, to be honest, weight issues with them weighing me really often, and also just weighing me in open spaces, and I don't feel comfortable with that. And I've given them feedback on that in the past. I don't want to be weighed in front of everyone. I prefer to keep it discreet. And I had some challenges with my weight as a teenager. And then postpartum, I was a really good weight. I was really happy, but I actually had weight loss as a result of the cancer. So it's a bit of a challenging topic. But basically I just asked if they can weigh me the least amount possible, go off a reading. And I had been weighed about within the last 7 days. So I asked them not to. And then they kind of forced me to get weighed. And I just said, have you looked at my notes? And there were a couple of really experienced nurses. And they said, yes, they've looked at my notes. But they obviously hadn't looked into, what that meant to me and how it would make me feel. Also on that occasion, I was waiting for a call to know if I'll be extending my chemo by 2 months or not. My daughter was also being looked after by family members, and my appointment was due to start at 10, and it's meant to take 240 minutes, which is 4 hours. But I was actually there in the end for 6.5 hours, and I just felt anxious to get back to my daughter. I've let them know as well, like, I have a little one, she's only 15 months. I'd like to get back to her. And so, yeah, it was just frustrating. They didn't explain that there were going to be any delays, and maybe this all sounds like first world problems, but all these little things as a patient just make the journey that much harder. I also, they couldn't get the needle in, and I got a big bruise on my arm. They mentioned an injection that was not relevant to me that they were going to do because my neutrophils are very low, which is the thing where my immunity is compromised. Whereas my doctor said I don't need that injection. So there were a lot of things, and I just felt like I wasn't informed. And how can you consent to getting your chemo when things are not explained? I learned a lot of this through doing a birthing course and having a really good birthing experience, having some challenges, but advocating for myself. And over this whole process of not getting diagnosed for 6 months, I think I really had to advocate for myself. But when they weighed me and they did a few things where they weren't explaining things, they were just kind of talking amongst themselves like I wasn't there. And it really got to me, and I did start to sort of tear up and get upset there. When you're on the ward and you're getting chemo, you're around a lot of other patients. There's a lot going on. There's a lot of nurses. And I had I've had a lot of students kind of observing me and coming and going, but I've never consented to that. I'm definitely the type of person who thinks, we need training and we need to train up students, and I'm all for learning, but I've had a few bad interactions with students. And this time again, I tried to chat to the student that was there. They left me alone with her, and she explained that she was a first year student and this was her second day on placement. And I realized she really didn't have very much of a briefing in chemotherapy or nursing or clinical skills. And I was in a hard place, and I didn't really want to have additional people unless it was absolutely necessary. I just prefer to have, the nurse that I'm working with, and that would be great. But I had all these people coming and going, and it really got to me. I was at a low point, and I was like, okay, I'm going to turn this around because that's just my nature. And so I said to her, how long have you been nursing? Found out it was her second day in her first year. We've all been there, right? But for me in that moment, I didn't think it was appropriate for where I was at as a patient to be left alone with someone that early on. And I wouldn't want, even if it was me at that point, I wouldn't know what to do. As a student on that time, I think I was a complex case because of where I was emotionally. And I think that's hard for any student nurse. Even an experienced nurse, I think it would be hard to work with me at that point. And so then I was like, let's turn this around. I'll just ask her about herself. She was an international student. And I said, so you're going to be a nurse? Tell me more about that. And she said, oh no, this is just my plan B. And I was like, okay, what's your plan A? And she said, my plan A is to rot in bed. And that really got to me because I'd give anything just to be healthy right now. And to have that opportunity, and to just, when this person was healthy, able to do, so many things with their life, for them to say their plan A and what they prefer to do is to be rotting in bed, it was just it was the wrong moment, the wrong person, the wrong level. I wasn't happy with it. And so, yeah, that was hard. The chemo, it just got harder from there. Yeah, I was bruised. I started feeling a burning sensation with one of the drugs. I just felt like I was going downhill, and then one of the nurses was like, oh, you've got the wrong cannula in. You need to ask for a wider needle and a bigger cannula next time. And I'm just like, is that my responsibility as a patient to actually tell the nurses what type of cannula I need? I don't think so. So that was interesting. And then what else? Yeah, I just felt like I didn't have a say. I felt like I didn't know what was going on. I didn't know how long I'd be there. I wanted to get back to my family. I was waiting to know if I have to extend chemo. Am I halfway or a third of the way? I don't know. And I just wrote some notes here. But yeah, I think that's everything that in a nutshell. And then on the way home, because the doctor also said she was going to call at 12 and give me the result, or like just after the meeting, which was meant to be at 12. And then it like time was going, and then it was like 4:30 or so, and we were on the way home, and I got the call in the car. But like the last 24 hours before that, I was just processing, okay, am I going to have to extend this by X amount of rounds? I already feel like I'm really trying my best here, but I just don't know if I can, adding those on was just not what I was expecting. She called me and she said the multidisciplinary team looked at it, and because it was only 0.3 difference of the brightness between the cancer and the liver, they were going to take the reading as equal, which means I do not need to extend chemo by 2 months. But the only thing then that I worry about is like chances of relapse. If that is a Deauville score higher than 1 to 3, and she'd mentioned that, she's like, we want to make sure you don't relapse. So just something on my mind. And yeah, from there I felt numb. I felt like I couldn't celebrate because of all of these other things going on. Maybe I was trying to, plan ahead and have a plan for what the outcome would be, and that just is not possible right now. So it's good news in the end. And since that PET scan, I've had my 5th round of chemo. It was a challenging day. I talked to them about some of the things and about the weighing and how I'd already given that feedback. And my cancer care nurse is on leave at the moment, so I had to tell someone else about it. But I just said, as a patient, I expect to know what's going on. I expect that people would have a name badge, introduce themselves, tell me what's happening, and not assume things. And, if I don't want a student, because I've had one person that was passing out when they saw the needle when I had to get the Zoladex. I had another student that was just talking a lot about lymphoma, and how, and it just freaked me out a lot, to be honest. So, and over multiple sessions. So I just feel like I'm at a low point. I love supporting people. I love supporting students, but at this moment, I just have to do everything I can to keep going, and I don't feel comfortable having all these outside noises, and I just need to get in the zone and continue on. So I was also trying to, while I was at the hospital, I was like, I'll get some admin done. There's some things I needed to submit to Centrelink in regards to childcare. It was really frustrating. I was trying to do it through a portal and it was not uploading. So that was just adding to it. But then I talked to my counsellor, the more straightforward one, the following day, and she just reminded me, the main thing is that I don't have to extend chemo. Focus on that. And she just said, look at everything that is prosperous, abundant, and energized. Focus on those. Don't think about this little, regression that's trying to get you to think about the negative, because there's so much positive and there's so much there. And even looking at myself over time, looking where my voice has got to, looking at how I've handled this situation, I'm so proud of myself, because younger Alicia, I just don't know how I would handle this situation. To me, cancer seems very, very scary, but it's not as scary. There's support and there's there's prosperity and there's a beautiful life after this. That was just a very low week and moment, and even leading up to the result from the PET scan and the PET scan, I was feeling so anxious because I didn't know what the outcome would be. I feel like in career and life, there's many things you can work towards, and you can try and, control the outcome as much as you can. But in this situation, I just didn't feel like I had much control. I definitely was doing a lot of inner work, but then I did notice like my diet slipping, like I was eating more. I wasn't getting out exercising because it's been very, very cold in Canberra. But that's not an excuse, like, you still can. So yeah, I just wanted to talk to my more straightforward counsellor. She was really lovely. I mostly just chatted through all the updates, and she just said she's like so proud of me and how far I've come. She said the hardships make great content, so that's good to know as well. She asked me she's like, how do you fit it all in what you're doing? And I didn't even think about that because I'm definitely not where I used to be in terms of doing 200 things at once. And yeah, she said take a moment to celebrate now. So I think that's what I'm going to do. It didn't go to plan. I had people that I could talk to, like my cousin. I just shared it all with her, and I think that really helped in voice notes. And yeah, I think that's mostly everything. So now we've completed 5 rounds out of 8. We're on to cycle 3. So the 28-day cycles, we start again. I had it on Wednesday, now it's Friday. So I'm day 3 of the 28-day cycle, the 3rd round. Overall, what's that, like 59 days in to the chemo journey? I've lost a fair bit of hair, but I still haven't shaved my head. I'm obviously wearing my wig now. I'm getting more used to wearing my wig, but I've been out and about and people haven't recognized me as much. So I thought I'd record in this wig. I got to go, so I worked yesterday and today. Yesterday evening, I got to go op shopping, which was so nice. Just like normal things make me happy. I got to go out to dinner with my family. On the first few days of the cycle, I have a steroid and some drugs that support me to just feel a bit normal. And then, work today. And then I got to go to a beautiful lunch with the really lovely group of people from Wisdom Recruitment. And yeah, it was just nice to talk to friends, meet some new connections. That's what I usually do. But I haven't been doing anything like that for a long time, so it's a little bit different. I miss my in-laws who are overseas. This weekend I have my friend's daughter's birthday, which I'm really excited for. It's my sister's birthday today as well. Happy birthday, sis. Hope you're having a great day. And on Sunday we'll go to the zoo to celebrate. I'll just see how I go. I probably will get tired here and there, but I'll just keep going as long as I can. And my brother-in-law is having a house party tomorrow night, but I'm not sure. It just might not be possible to attend that one just because it's a closed environment and lots of people. If it's an outdoor environment, it's much easier. It's kind of like with my being immunocompromised. If it's outside, just think of like COVID times and that kind of works. I don't know what's next, but that's in a nutshell what's happened. Overall, it's positive, but there were some very hard days where I thought this was going to extend. I just want to remember that and acknowledge that, but also to say that I got through it. I have a few fellow lymphoma patients that I talk to in a Facebook Messenger group, and I can always ask them about wigs and, what did they experience in chemo and a bunch of different things. And I'm really grateful to be able to chat to fellow people going through what I'm going through. I hope you're having a great day or evening wherever you are. And thank you again to everyone for all their support. I really do feel it, and it does make a difference. Your prayers and wishes, I couldn't do it without you. Thank you. Bye.